If you walk into a typical doctor's office today, whether you are in New York, Toronto, or Sydney, there is a very high probability the interaction will go exactly like this. The doctor will look at your chart, look at your latest blood pressure reading, and tell you the exact same thing they tell a perfectly healthy, athletic 30-year-old. Your target is 120 over 80. They say it with absolute confidence. They say it because it is the ingrained medical standard. It is printed on every chart, taught in every medical school, and programmed into every digital blood pressure cuff you buy at the pharmacy. But if you are over the age of 65, following that generic, blanket advice without looking at the real, nuanced science could be one of the most risky decisions you ever make for your longevity and your independence. What if I told you that aggressively forcing your blood pressure down to a perfect number on a clinical machine could actually be starving your brain of essential oxygen? What if I told you that this pursuit of 120 over 80 could be doubling your risk of irreversible kidney decline? And perhaps most frighteningly, what if it is setting you up for a catastrophic fall that could permanently alter your quality of life?
Welcome back. Today, we are going to peel back the curtain on the medical establishment's greatest ongoing debate. We are going to look at why a landmark 2023 study published in JAMA Internal Medicine by Dr. Chirag Bavishi and his colleagues suggests that what is considered optimal for your heart might actually be a disaster for your kidneys and your brain. In the next 15 minutes, we are going far beyond the superficial health headlines. We are going to dive into deep medical analysis. I am going to reveal the exact individualized blood pressure sweet spot for seniors. We will explore the biomechanics of aging arteries, why the 120/80 target is often a dangerous myth for the elderly, and the one simple, scientifically backed stand-up test you must perform at home to see if you are currently being over-medicated. Grab a pen and a piece of paper, because the information we are covering today is vital, and it is entirely based on peer-reviewed clinical data. To truly understand why blood pressure guidelines are so rigid and why they are currently so controversial, we have to look at the specific study that changed everything in modern cardiology. It is called the Systolic Blood Pressure Intervention Trial, commonly known as the SPRINT trial. In 2015, the initial data from this massive clinical trial was released. The study included over 9,000 adults and specifically featured a subgroup of over 2,600 adults aged 75 and older. The initial data looked like an absolute miracle to the medical community. The researchers found that patients who were aggressively medicated to push their systolic target, that is, the top number, down to less than 120, showed a 33% lower risk of cardiovascular events, like heart attacks and heart failure. Even more incredible to the researchers, the overall risk of death in that aggressively treated group dropped by 32%. The results were considered so definitive that the trial was actually stopped early. Because of SPRINT, medical guidelines across the United States, Canada, and Australia shifted almost overnight. Doctors were instructed to be aggressive. They started prescribing 3, 4, or even 5 different potent medications just to force their older patients to hit that magical 120 threshold. But there was a massive amount of fine print to the SPRINT study that was never shouted from the rooftops by the mainstream media. When we apply deep analysis to the methodology of SPRINT, glaring issues emerge for the average senior. First, who was excluded from this trial? The researchers deliberately excluded people who had diabetes. They excluded people who had suffered a prior stroke. They excluded anyone living in a nursing home, and they excluded people with advanced kidney disease. In other words, they excluded a massive percentage of the actual senior population. Furthermore, the way they measured blood pressure in the SPRINT trial was highly unnatural.
Patients were placed in a quiet, isolated room alone, left to rest for 5 full minutes, and an automated machine took 3 readings without a doctor or nurse present. This completely eliminated white coat syndrome. If you go to your doctor today, they usually slap the cuff on you while you were still talking, right after you walk down the hallway. That clinical reading is almost always 10 to 15 points higher than a resting home reading. So if your doctor is using a standard rushed office reading to medicate you down to 120, your actual real-world blood pressure might be dropping to 105 or 110 when you are simply sitting at home. And that is where the danger begins. This is where the science of chronological age versus biological age takes a very different turn. A landmark observational study led by Dr. Benetos, which looked at seniors over the age of 80, revealed a U-shaped mortality curve that should make every senior and every physician pause and reconsider. They found that in older adults who are considered biologically frail, meaning they have lost muscle mass, experience fatigue, or have mobility issues, having a low blood pressure was actually associated with a significantly higher risk of death. Specifically, a systolic number persistently less than 130 in a frail senior was a major red flag for mortality. Why would lower pressure be more dangerous? To understand this, we have to look at the structural changes inside your body. As we age, our vascular system undergoes a process known as arteriosclerosis, the natural stiffening of the arterial walls. Think of a brand new, highly flexible rubber garden hose. When you turn on the water, the hose expands to accommodate the pressure. Now, imagine a hose that has been left out in the baking sun for 20 years. It is stiff. It is rigid. It has lost its elasticity. Your arteries do the exact same thing. In your 30s, your arteries easily expand to push blood to your extremities. But in your 70s and 80s, those pathways are stiff. Now, think about the physics of the human body. To get oxygen-rich blood all the way up into the intricate microvessels of your brain, working against the force of gravity, and to push that blood all the way down to your toes through those stiffened arterial pathways, your heart actually requires a slightly higher baseline pressure. When we use heavy doses of synthetic medications to artificially force that pressure down to 120, we might be protecting the heart muscle from overworking, but we are essentially suffocating the other vital organs. In medicine, we call this tissue hypoperfusion. It means the tissues are not getting enough blood flow. This is the exact reason why so many seniors on aggressive blood pressure regimens feel chronically dizzy, confused, lethargic, or simply out of it. It isn't early onset dementia. It isn't a natural sign of getting older. It is simply a mechanical lack of pressure. The brain is not getting enough oxygen to function at its peak. The brain is not the only organ that suffers when blood pressure is artificially plummeted. We must talk about your kidneys. In July of 2023, the medical world received a stark warning. Dr. Bavishi and his team published a massive meta-analysis in JAMA Internal Medicine, reviewing data from over 10,000 older patients. The researchers wanted to see the long-term effects of intensive blood pressure control. The data confirmed a terrifying trade-off. While intensive control, pushing the top number below 120 or 130, does indeed help prevent heart failure, it significantly accelerates the risk of irreversible renal decline. Let's look at the biology of why this happens. Your kidneys are essentially complex filtration systems made up of millions of tiny filters called nephrons. To push toxins, waste, and excess fluid out of your blood and into your urine, Your kidneys require a very specific amount of hydrostatic pressure. This is measured as your glomerular filtration rate, or GFR. If your blood pressure drops too low, the pressure inside those tiny kidney filters drops as well. The kidneys simply cannot filter out the toxins. The waste builds up in your bloodstream. Over time, this chronic low pressure causes the kidney tissue to slowly die off. Think about that clinical trade-off. You might be marginally saving your heart from a theoretical future event, but you are actively accelerating irreversible damage to your kidneys today. For many seniors, the daily, lived symptoms of kidney decline are devastating. The extreme fatigue that keeps you in a chair all day, the heavy swelling and fluid retention in your lower legs and ankles, the buildup of bodily toxins that causes mental fog. These symptoms are far more damaging to your daily joy, your mobility, and your independence than a slightly higher blood pressure number ever would have been. This is why Dr. Franz Messerly, one of the leading global experts on hypertension and a vocal critic of the Sprint guidelines, now suggests that a target of less than 140 is a much safer, more logical entry-level goal for most people over the age of 65. Pushing numbers lower than 130 should only be attempted if you are exceptionally biologically fit, completely free of frailty, and under constant, rigorous kidney monitoring. Now we arrive at perhaps the biggest psychological and physical fear for anyone over the age of 65, the fear of falling. We have been told for years that high blood pressure is dangerous, but research published by Dr. Bromfield in the journal Hypertension reveals a much more nuanced truth about medication and mobility. When you transition from sitting in a chair to standing up, gravity instantly pulls your blood down into your legs and abdomen. In a healthy, unmedicated system, your body has built-in sensors called baroreceptors located in your neck. The absolute millisecond you stand up, these sensors detect the drop in blood pressure and instantly tell your heart to beat a little faster and your blood vessels to constrict. This shoots the blood right back up to your brain so you don't pass out. But what happens when you are taking beta blockers, ACE inhibitors, or calcium channel blockers? Those medications chemically block that exact reflex. They prevent the blood vessels from constricting. The result is a condition called orthostatic hypotension. This is that sudden, terrifying, lightheaded feeling you get when you stand up too fast, or when you get out of bed in the middle of the night to use the restroom. Your vision might blur, your legs might feel like jelly, and the room spins. If your blood pressure drops significantly upon standing, your risk of a catastrophic hip fracture or a traumatic head injury skyrockets. A broken hip at age 75 is not just a broken bone. It is often the end of independent living. This is why, if you are currently taking any prescription blood pressure medications, you absolutely must perform a simple diagnostic check at home. I call it the stand-up test. Here is exactly how you do it, step by step. Number 1, sit comfortably in a chair for 5 minutes. Do not talk, do not cross your legs. Number 2, take your blood pressure while seated and write that exact number down. Number 3, leave the cuff on your arm. Stand up. Number 4, wait exactly 1 minute while standing still, and then press the button to take your blood pressure again. Look at the top number, your systolic pressure. If that top number falls by 20 points or more when you stand up, for example, if you are 135 sitting down, but you drop to 110 when you stand, your medication dose is very likely too high for your current biological age and vascular stiffness. You are living in what I call the fall trap, and you need to take those numbers to your doctor immediately to discuss safely tapering your dosage. So after looking at the Sprint trial's flaws, the U-shaped mortality curve, the danger to your kidneys, and the severe risk of orthostatic falls, what is the actual, scientifically backed best number for you. As we move into the latest clinical understandings for 2025 and 2026, the brightest minds in geriatric cardiology are finally moving away from the dangerous one-size-fits-all mentality. The new approach is entirely based on your biological category. Here is the general medical consensus today. If you fall into the robust category, meaning you are over 65, but you are highly active, you walk daily, you play golf or tennis, you have no major mobility issues, and your kidneys are functioning perfectly, aiming for less than 130/80 is generally considered safe and will continue to protect your brain from microvascular damage.
However, if you fall into the frail category, meaning you are over 80 years old, or you feel physically weak, you struggle with your daily balance, you require a cane, or your blood work shows declining kidney function, the deep science suggests a much more conservative target. For you, maintaining a systolic pressure between 140 and 150/90 is often vastly safer for your brain perfusion, your kidney filtration, and your overall survival. Do not let a generic printed chart in a waiting room define your localized health. Your best blood pressure number depends entirely on your unique level of biological frailty, the structural health of your kidneys, and exactly how your brain feels when you stand up from a chair. You must advocate for yourself, and you must demand that your doctor treats the patient sitting in front of them, not just the number on the digital monitor. If you found this deep, research-based dive into the hidden physiological side of blood pressure science helpful, please take a moment to hit the subscribe button. We are building a highly informed community here of seniors who refuse to be treated like just another statistic in a rushed medical system. And I genuinely want to hear from you down in the comments section below. What was your very last blood pressure reading at the doctor's office versus at home? And more importantly, do you ever experience that dizzy, lightheaded feeling when you stand up? I read every single story you share. Your shared experiences provide incredible value, and they help our entire community grow stronger, wiser, and more independent. Until next time, stay healthy, stay informed, and always stay independent.